Today we're going to discuss admissions, transfers, and discharges. An admission is the official entry of a person into a healthcare setting. A transfer is moving a person to another healthcare setting. And then a discharge is the official departure of a person from a healthcare setting. Admission causes anxiety and fear in patients, residents, and families. They worry about serious health problems, the different treatments and surgeries they may have, and they're also often worried about pain. In some agencies, a transfer refers to moving a person to a new room within the agency. It can also refer to moving a patient from the hospital to a rehab facility or rehab facility back to the hospital. Transfers occur because of a change of condition. The person may request to change rooms or if the roommates do not get along. Admissions, transfers, and discharges are critical events. These events involve privacy and confidentiality, understanding and communicating with the person, communication with the health team, respect for the person and the person's property, being kind, courteous, and respectful, and then also reporting and recording. If you remember, reporting is orally giving a report. Recording is when you write down something for the medical record. So for the admissions process, the admitting staff member or a nurse obtains the patient's identifying information, which includes the patient's full name, age, and date of birth. The patient is given an ID number and an ID bracelet. The admitting papers and consent for treatment are signed. The room is prepared for the person's arrival. So what that means is that an admission pack is prepared. An admission pack often includes a wash basin, a bedpan or urinal, different toiletry items, and then a water pitcher and a cup. And when preparing the resident's room, you get the vital sign equipment assembled, you open the curtains, adjust the room temperature, and make sure that the bed is in low position with the wheels locked. You also want to, when the person arrives, orient the resident to the facility. So what that means is you introduce yourself, including your title, identify how you will work with the resident providing care, introduce the resident to his or her roommate, if there is one. It's important to be friendly and polite and include family and significant others in the conversation. You want to review resident rights and review facility rules. And those include meal times, the smoking policy, visitation rules, and then how to order food from the menu. And sometimes the admissions process will include a tour of the facility, like the dining area, the bathing area, and the activity room. Orienting the person to his or her room, you also want to show them how to use the call bell, how to adjust the position on the bed, where the bathroom is located, how to use the lights, how to use the TV, and how to use the telephone. Admission is the first chance for the facility to make a good impression on the patient. So to make a good impression, the CNA must greet the person by name and title, introduce themselves by name and title, make those roommate introductions, act in a professional manner, and treat the person with dignity and respect. In long-term care, the admission process is usually started 2 to 3 days before the person enters the center. The resident rights are verbally explained and the person receives a written copy. The person's photo is often taken and is kept as part of the medical record. With long-term care, the center is the person's home. So it's important to make the room as home-like as possible. Care for resident personal belongings. So you want to complete a resident inventory sheet. When completing that, you describe all resident belongings completely and accurately. You want to help the person label all personal items with their name and date of birth, and also assist the patient in unpacking their personal items. So the CNA's role in the admissions process. So first, you wash your hands prior to patient care. You explain what you're doing to the resident. You provide for privacy. And if it's appropriate, you ask the family just to wait outside the room while you're completing whatever task needs to be done. You obtain baseline vital signs, height and weight. You fill their water pitcher with fresh water. You ensure that they're comfortable in their bed. You place the call bell within reach and demonstrate how to use it. You'll document vital signs, height, and weight, and you'll report any abnormal findings to the nurse. So when you're admitting a patient, you observe the condition of his or her skin, how they move, their behavior, and their ability to communicate. And then you will document everything, so including how you cared for the resident's personal belongings, any observations you made, and vital signs when you are finished. This here is a sample admissions checklist. So for the admission procedure includes measuring the person's height and weight, measuring vital signs. Sometimes you'll be required to obtain a urine specimen. You complete a clothing and personal belongings list. You orient the person to the room, nursing unit, and agency. So when weighing the patient, you have the person wear a gown or sleepwear only. So clothing and footwear will add weight, so you won't have an accurate weight. You have the person void before being weighed. Provide a dry incontinence product if needed. It's important to weigh the person at the same time each day and use the same scale for weighing the patient. You also want to balance the scale to 0 before weighing. This is a picture of a standing scale like what we have in our classroom, and that's used for patients who can stand and walk. This is a chair scale for patients who maybe can't stand long enough to get their weight on the standing scale. And then this is a wheelchair scale. So you weigh the person in their wheelchair. And oftentimes there is a marking on the wheelchair that says how many pounds the wheelchair is. So you would weigh the patient in their wheelchair and then subtract the amount of weight for the wheelchair by itself. And that's how you get your weight of your patient. To measure a patient's height in bed, you use a tape measure and a ruler, and you have them lying supine. So transfers and discharges are usually planned in advance. So for home care, equipment, and therapies, they're all arranged as the patient needs. AMA just means against medical advice. So that's when a patient leaves when the doctors or advanced practice providers are recommending that they stay in the facility, but they decide that they want to leave anyway. So the nurse will tell the CNA when to start the transfer or discharge procedures and when the person is ready to leave. So for these things, you want to prepare the resident for transfer. So the resident's informed of their transfer as soon as possible. You assist the resident in preparing for moving their belongings. You accompany the resident to the new unit. Provide report to the new unit personnel. So vital signs, condition of skin, mobility, ability to communicate. You introduce the resident to the new unit staff. Assist the resident in unpacking his or her belongings on the new unit. Make the resident comfortable. Have the call bell in easy reach. You document exactly what was done and then report any changes to the nurse. Now, when you're preparing a resident for discharge, you explain what you will be doing and provide per privacy. You compare the admission resident inventory sheet of items to the items being packed for discharge. You carefully assist the resident to pack his or her belongings. Assist them to dress in personal clothing. Assist them to say goodbye to staff. And then using a wheelchair, you take the resident to the discharge area. You lock the wheels on the wheelchair and assist the resident into the vehicle. Then you'll return the wheelchair to the unit, and then you'll document what happened. If a patient states that he or she wants to leave AMA or against medical advice, the CNA needs to tell the nurse immediately. So in long-term care, transfers and discharges are a little bit different. CMS has standards for nursing center transfers and discharges. They require that a person's rights are protected, and it's an ombudsman that protects the person's interests. So reasons for transfers or discharge from long-term care include that the person's welfare can't be met at the center, the person's health has improved, so the center services are no longer needed, the health or safety of others is in danger, the person hasn't paid to stay in the center, or the center closes. The person and their family must be told of the date and time of transfer or discharge. So after a transfer or discharge, the CNA is responsible for stripping the bed, placing all linen, used and unused, in the laundry hamper. And then it's important to inform housekeeping services that the room is ready for terminal cleaning. And that just means that they're going to get the room ready for the next patient.